On January 30th, 2025, Uganda was shaken by a new health crisis. The Sudan strain of Ebola virus disease was confirmed in Kampala. The index case was a 32-year-old male nurse at Mulago National Referral Hospital. His symptoms seemed ordinary at first, but quickly turned fatal. By the time the confirmation came in, he had already moved across multiple districts, unknowingly exposing others. The Uganda Red Cross Society mounted a response, and within hours, an emergency task force was activated. Ambulances were deployed, volunteers were briefed, and drills for safe and dignified burials were conducted. An entire operation began, and it was rooted in preparedness, guided by experience, and driven by compassion. As government teams initiated contact tracing and surveillance, Uganda Red Cross Society stepped in to strengthen coordination across Kampala, Wakiso, Mbale, Jinja, Iganga, and Mukono. Volunteers were integrated in community screening at markets, hospitals, and border points. Hand-washing stations were installed. Radio messages, posters, and school outreaches began to flood communities, replacing fear with facts and silence with awareness. Behind every ambulance stood a trained volunteer. Behind every burial, a courageous team. Behind every message, a Red Cross volunteer walking dusty roads, knocking on doors, and speaking to local communities. Over 400 volunteers were mobilized. Many had already been part of the Mpox response and quickly adapted. Village task forces were reactivated. Private clinics were engaged. Schools became platforms for prevention. In every district of the response, Uganda Red Cross volunteers supported community-based surveillance, using mobile phones to report alerts and submit zero reports in real time. At borders and landing sites, screening intensified. Where others saw risk, we saw opportunity to break the chain to stay ahead of the spread. Psychosocial support teams working silently in the background, helping families cope with loss, and volunteers process trauma. Every life mattered. Every goodbye was handled with care. Uganda has faced Ebola before, from Gulu in 2000 to Mubende in 2022. But with each outbreak came lessons, and this time we were ready. The Uganda Red Cross built on past experience, integrating epidemic response into every layer of its work, from warehousing supplies to digital dashboards, from community engagement to coordination with global partners. The Uganda Red Cross Society stands at the front lines, saving lives, restoring dignity, and keeping humanity at the center of every emergency.